My name is Louiselle Godbout. I'm a pharmacist. I'm glad to see that the committee has invited pharmacists because I feel that pharmacists are often neglected in part of this goal. But I think pharmacists are very important in, thank you, in your live it part of your cancer journey. Part of your live it part is quality of life, and I'm sure that all of you are really worried as you go through this that quality of life is very important to you. Okay, so as we mentioned, the earlier panel mentioned that there are different types of therapies, and of course there are different side effects, but I think that we all know that drug therapy does not come without side effects, and it has to be sort of a benefit risk factor that you have to decide. And I think it's up to you to decide. We can explain to you what can be done and how you can manage it, but I think it's up to you to decide what risks and benefits you're willing to tolerate. We've mentioned the oral therapies. We've also mentioned the injectable therapies. The oral therapies that are available in Canada at this time are your sunitinib, your sorafenib, pazopanib, axitinib. All those agents were mentioned earlier. They're all oral, they're all dosed differently, and they are, depending on the province that you live, will be accessible to you. Sunitinib is one of the very first ones that came to life as a kidney cancer agent, and it is today, or this year, celebrating its 10th anniversary. So all these drugs have come on the market in the last 10 years. So we know that cancer treatment has changed in the last 10 years. mTOR inhibitors, everolimus. There's also an mTOR inhibitor that's available injectably. So because you're mostly on your own when, well, not on your own, but you take these agents at home, you don't have the care of a nurse that comes to you to give you your drug. I think it's important for you to know how to manage the side effect of these drugs. First thing is 60 to 70% of patients will have some kind of a side effect with these drugs. And I think it's important for you to tell your physician and to tell your team, your healthcare team, what it is that you're experiencing, because most of these side effects we can manage. So you have to let us know what it is that you're experiencing so we can help you manage them. Hypertension is probably one of the ones with the VEGF, the TKIs, the tyrosine kinase inhibitors, is probably one of a very, very common side effect. And it's common also for people who already have pre-existing hypertension. So if you already have hypertension, it's very important for you to get either your family physician or someone in your healthcare to maintain and to manage your hypertension to its maximum so that you do have good control of your hypertension before you start these agents. You should monitor your blood pressure at home, and we're aiming for a blood pressure of 140/90. The usual treatments will be used to treat the hypertension if you do develop it. There are a couple of drug interactions, and most physicians and pharmacists will be aware of these, so they will not give you these agents with this type of therapy. Fatigue. Fatigue is, again, very important, and fatigue does affect quality of life. So you have to be sort of aware that probably will happen, but there are ways of managing it. You need to tell your doctor there may be some blood tests. Your thyroid may be low, not active enough. You may not have the proper elements in your blood, so you may be anemic. So we can rule these out. So you have to tell your doctor so he can order the proper blood test. You should aim to get about 30 minutes of exercise per day. If you can't do it in one sitting, do it in 2 sittings. And we've heard about exercise. And exercise will also improve your rest, so it's important to get your rest. Skin side effects, hand and foot. Everybody's heard about hand and foot. You can get really bad raw hands and feet that hurt, and that usually happens very early on in treatment before like 2 weeks into treatment. So if you can, and if you're lucky enough to get a manicure or pedicure before you start treatment, it's good. Don't get it done while you're on treatment because it can affect your And it happens we're on your calloused areas. So if you can get rid of your calluses, you can get some good fitting shoes, you can wear some gels in your shoes that will help you with that. Moisturize, moisturize, moisturize. That's what we tell people, and do it preventatively. Start before you have problems. The rash is the same thing. A rash usually happens in upper body. It usually happens where there's sun-exposed area. Sunscreen is very important also. If you get it in your head, use a mild shampoo. A dandruff shampoo should help with that. You can get a lot of itchiness with that. Again, moisturize, moisturize. And moisturizing, I mean not once a day, not twice a day, 3 to 4 times a day if you can. Any lotion is easier to apply. Cream stays on longer. If you can apply an ointment, ointment is like sort of a Vaseline. A cream is like sort of a whipped cream. A lotion is more liquid. It's easier to apply depending on your skin. Use what you can. Mouth sores. Mouth sores happen 20 to 50% of the patient depending on what agent you're on. Again, gentle cleaning, soft toothbrush, not a whitening toothpaste. Use a regular soft toothpaste. No alcohol rinses. You might want to make a home rinse with salt and baking soda. And you may need a coating agent, or tell your doctor you may need a anesthetic agent, because if it gets bad enough. And again, this affects your feeding, so you need to take care of this, and it needs to be looked after early in the treatment. Your GI side effects. I decided not to put any pictures here. I don't think anybody wants a picture of any of these. Diarrhea, as Steve has said earlier, it's probably the best laxatives that you'll ever have. Most patients will get diarrhea. We can adjust dose, we can do agents for that, so please let us know what's happening. I've had a patient who was on sunitinib and was told earlier on, because she had constipation, to continue with her stool softeners and her laxative. She was using both. Nobody had told her to stop it. You have to make sure that you stop any other agents that will affect your bowel movements. Oral hydration, if you have diarrhea, it's important for you to really hydrate yourself. Nausea and vomiting, small meals. Eat as often as you can. If really you can't eat food, harsh food, because your mouth is so sore, use liquid supplements. You can use milkshakes, you can use Ensure, you can use any product, but make sure you eat as often as you can. And even if you're not hungry, try to force a bit of food in. If you have loss of appetite, you can. If it's really bad, we can prescribe some steroids. That will also increase your energy, but it's really not, I'm not talking about medication treatment of these side effects. Now, the injectable agents that are available. Interferon, interleukin, which is your IL-2 that they discussed earlier. I'm from Ottawa, we don't do IL-2. All our patients who are fit enough to get IL-2 will have to go to the States. We can't do it here, we don't have the facility for it. Temsirolimus is your mTOR inhibitor in an injectable form, so you can get the same side effects with your temsirolimus as you can get with your everolimus. And of course, the new checkpoint inhibitors are new on the market, and they come with their whole set of side effects that are different, and you have to let anybody know that you're on an immune checkpoint inhibitor. Your immune-related agents cause inflammation. They are there to make sure that your T cells recognize your tumor and will eat your tumor, but they can eat all your healthy tissue. So anything that can happen, a colon inflammation, colitis, a liver inflammation, hepatitis, a pancreatic inflammation, pancreatitis, you can even get thyroid inflammation. They are treated differently than you would treat any other normal cancer agent. So it's important to let people know that you are on these agents, because they are really treated differently. And most of the drug companies that are coming out with these immune checkpoint inhibitors, nivolumab, pembrolizumab, have a wallet card. It's important for you to keep that wallet card with you, because it tells the emergency physician how to treat it.